I might just walk home right now. That was good for me. My name is Ryan McCann. I'm Director of Operations and Public Policy for the Indiana Family Institute. And first of all, we just want to thank you for coming out and being a part of self-government. Give yourself a round of applause. Thank you for being here. It's a beautiful thing when people get involved, and that's what really our country is founded upon, the principles of self-government and freedom to peaceably assemble and freedom of speech, and we appreciate you all taking time out of your day to come out and be a part of that. At the Indiana Family Institute, our mission is to strengthen families both in the home and the public square, and I couldn't help but come out and be a part of this tour to talk about some of the ideas on health care coming out of Washington, D.C. We want to protect all members of the family, from the unborn all the way to our senior citizens, and yeah, thank you. And so it felt like we needed to speak out on a few issues. I'll just touch on one for a minute and focus on some other things, and I know there'll be other speakers to talk about some tax issues with the health care bill and all sorts of things, but one thing that troubles us a bit is the way that the health care bill would use taxpayer funding towards the abortion industry, and that's something that we have a problem with. I won't focus on that a lot. I know that's not the primary issue for today, but if you'll see in Congress, there have been several amendments that have been offered to health care bills that would exclude abortion coverage for the public plan, and they've all been rejected, so that's something that troubles us. I'll move on to, as Sarah Palin labeled them, the death panels. Give Sarah Palin a round of applause, hopefully she can hear us. You know, that's a bit troubling to me when you look at an idea coming out of the government that you would have bureaucrats basically deciding what kind of benefits you as Americans would get on the public plan of health care. I think that's troubling for a number of reasons. Number one, because of the expense of the health care plan down the line, they're going to have to cut costs somewhere or raise taxes or both. And if you look at Europe, and some of our other speakers are going to talk about specific examples of this, but if you look at Europe, they've had to cut back benefits over the years with their plans, especially amongst the elderly population. And we just really think that's a moral issue for us. Canada as well, absolutely right. She's come up here and help me out. You got some good tips out there. That's absolutely right. Canada is high on that list as well. One issue you'll see are non-emergency kind of healthcare issues, like, for example, a hip surgery for elderly population. You know, if that's not covered in the plan, or possibly with the rationing, that there could be huge waiting lines for that kind of surgery. And I know the folks in my family and the people that I know that have had those kind of surgeries, it's really given them a new lease on life, and their quality of care is so much better from being able to, you know, get around to just take a walk, as opposed to being stuck in a wheelchair or worse. So those kind of issues are something we need to bring up, the cost of the plan and the benefits. The other thing I would just bring up is the debt that we're going to burden future members of our families, the young folks and the next generation with. I think that's a travesty, and I don't think any of us would want to burden the next generation with that kind of a tax load, trillions and trillions of dollars to pay off a healthcare plan that, in our estimation, will be worse quality and a lot of government rationing with increased expenses. And we just think that's the wrong way to go. Thank you. With that, just want to mention that with the increased expenses, we understand that there is a problem with the health care that we currently enjoy in the United States. No plan is going to be perfect, but there are options that can be addressed in Congress that can help the cost issue. And that's really, I think, the big issue with health care. It's the rising cost of health care, and that's something that needs to be addressed. There's tort reform out there to increase unnecessary lawsuits on the good doctors, and I hate to see the attacks on the good doctors and the insurance companies that are doing the right thing here in this state. I hate to see those kind of attacks, because if we had some tort reform, some of those doctors wouldn't have to pay outrageous expenses and could decrease costs in some of those areas. Another example would be being able to buy health insurance across state lines, and that's something that's been talked about for years. That could decrease costs in healthcare, and so it is very simple. It's just a matter of taking the right ideas to Congress and actually having them debated. Another good idea would be to, instead of just giving employers tax breaks, to give health care to their employees, to actually give employees themselves tax breaks, to be able to go out in the free market and to decide what health plan they want on their own. Let's bring the free market into this debate. All right? Thank you. Well, I just want to say once again, thank you for an exercise in self-government. It is, I know your elected officials are paying attention. You can see with the news coming out of Washington, D.C., they're paying attention that some of the ideas that I'm talking about are not going over well with the American people. They're backtracking on some of those issues already. Keep up the good work of getting involved in your government because it's making a difference. Thank you very much. Thank you.